Welcome back to the new norm. I'm Dr. Lou Graham, and this program is brought to you by Midway Dental and Catapult Education. So, what's new with COVID? Well, what's quite interesting is that in Denmark, they are now starting to think that they've got this virus somewhat under control. They were one of the first countries to shut down the schools, institute social distancing, close certain institutions, and now they're going to be potentially easing up. They've had less than 300 deaths, and this may be a lead forward in some easing of restrictions. And that's really interesting considering in Asia, where they also felt this was under control, they've seen an uptick in new cases. So again, I think there's just so much going on with this virus of unknown that there's just still a lot of caution. Caution relates to also the long-term effects of this virus. There's more and more news coming out about other issues about long-term effects. We'll be reporting on that later this week. There are issues about immunity. If you have immunity, or do you have IgG or other antibodies, are you really immune? Are they starting to see second recurrent infections is a question. And this would be coming out of, obviously, China's the first one to be hit, or Italy. News to be seen on that. But the question then is how long, if this immunity is in effect, how long does it really last? And that's a really huge question they're starting to understand right now. So as we look at what we've done correctly and incorrectly, it's really interesting that Forbes just came out with an article about how 6 women leaders have led their countries into very proactive patterns of what to do to minimize COVID spread in their country. It was in Forbes. It's a great read. And it's interesting because we can learn about what we should be doing as I look at this. And again, there are many great male leaders out there in the world also. But one such leader in Taiwan has really been so aggressive in such a wonderful way that the country yesterday announced they're donating 10 million masks to the United States and Europe. Again, that's where globalization has a beautiful possibility of working. So as I look at these leaders and other leaders, I'm hoping that our governors, and you can start see them starting to work together, they can actually work on how state by state we can start to coordinate efforts to really start to get a control over this virus. No doubt about it, and I think that's a state by state issue, but we've all got to be working together. Another interesting update that I've got to talk about is a new release from Apple. And I'm going to scroll down here, and I've just got to tell you about this. I think technology is totally in its infancy about how we're going to track, control this virus. So Apple has just announced a new tool, and it will basically be allowing you to see how people are actually social distancing in your community. But it's not just your community. The tool itself uses Apple Maps, and it really looks at trends in people's movements. And this can go by country, state, city, and potentially neighborhood. It's how many people are driving, walking, using mass transit. I think this is the beginning, but I think if once we start understanding all of this and we can actually track patients, know who is virus free, who has the virus, who's been isolated, I think then eventually, I think we will be able to open our practices up to a new norm, because we'll know who's walking into our offices. And if they're being tracked and we're being told, and we know they're virus free, that will be a great day, hopefully in the near future. Okay, that's my initial update of the news of what's going on. And now I want to bring on our guest. I've known Carla Cohn for years. She's a wonderful member of Catapult. She lives in Winnipeg, Canada. She's a general dentist who really just sees kids. God bless her. That's the opposite of my world. That was the path that she took. So let's welcome Carla. And Carla, my first question is, what's going on in Canada?
Well, thank you, Lou, and thank you for having me on this
Of
interview.
course.
Very pleased to be here. What's happening in Canada is the same that's happening in the States. We are a little bit more blessed by virtue of the fact that we simply have less population than you have in the United States. So in Canada, our population is somewhere around 38 million versus your 328 million. And so we have a little bit lower infectivity rate than you do in the States, but we're pretty close. So, everything's always bigger and better in the States. We like to joke here in Canada, including
Right.
COVID-19. So it's here and it's alive, and we've got the same protocols in place that you do in many of your states, where we've got closure of our dental offices and limitation to just emergency and true emergencies for our patients.
And are Canadians being tested yet, as as province by province, or is that just not happening yet?
It is happening. To what extent is it happening, and is it happening enough, has been the great debate that's been going back and forth through our provinces and our Canadian government in general. And the feeling is, of course, that not enough people are being tested because we just simply
Right.
don't have enough tests out there. And initially, when we were limiting our testing to those that had traveled, then we started to see the community spread, of course. We see that the testing is not enough to actually tell us what the true infection rate really is.
Right, right. So how do you see this pandemic affecting how we deliver care to children? How do you look at it in your world?
Well, that's the crystal ball question, and I think that at this point, things change so rapidly. This came upon us so rapidly, and at the beginning, when this pandemic was just evolving and coming to North America, we were changing our protocols day by day, sometimes hour by hour, and what we thought to be a ridiculous idea in what we were doing for protective equipment, on a Monday, on Tuesday, that was like, well, of course we should be doing that. So to decide or think about what it is that we're going to be doing in the coming weeks and months is a difficult question. And I think that we really need to look at our colleagues in Europe. And I was communicating with a colleague in Italy just about an hour ago, and what they're doing in terms of protective equipment. And I think that certainly our world is going to change, and I don't think that that's a bad thing that our dental world changes, because I think there's a lot of things that need to be repaired in the way that we deliver dentistry to our patients. From our protective equipment that we're going to wear, which is going to change the way that we're delivering dentistry, the cost of delivering dentistry, the timing of delivering dentistry, the time that it's going to take to change, and then also the procedures that we're going to be seeing that we're going to be able to do. And I think this is going to evolve as we get out of this onto the other side of the pandemic, where we start to be able to come back to practice and to do procedures. And I think that in the terms of seeing kids, which is what I do exclusively, we are going to have to start looking at all of our non-aerosol types of treatments to begin with, because even if we do have our protocols in place with protective equipment and we feel that things are solid and we're bulletproof, there's still going to be a lot of concern out there from our dental professional in general and from our patients that we're seeing, for whether we're going to be able to completely say that yes, we're not going to be creating any aerosol, that we're not going to infect the next person, we're not going to infect the person across the hall. So the changes are going to be enormous coming and moving forward, and I think that it's going to be gradual too.
So let me ask you, like your conversation with Italy, so we'll get Italy, Canada, and US. What were some guidelines that they're doing in Italy, if you don't mind just sharing that? Were there some pearls that you'd like to share or not?
Sure.
Just curious.
Yeah, so this individual that I was speaking to, he's got protective equipment as we think that we're going to be wearing protective equipment with the N95 masks. But again, keeping that protective equipment as long as we possibly can, because one of the challenges here, and I know it is in the States as well, is our protective equipment needs to go to our frontline healthcare
Right.
workers that are seeing people in hospitals. That's the priority level. Whether it's that or fixing, whether we're intubating a patient or whether we're fixing a tooth, the intubating patient wins out. So the challenge there is to have the protective equipment, and that's the challenge that this individual has in Italy as well. So to have the protective equipment and then to make it last for the whole day. So things that we've been talking about, like, wearing your N95 mask and then placing another mask over top of it so
Right.
that you can
Right.
wear that N95 mask throughout the day. Wearing gowns, double gloving, all of the proper hand hygiene that has to take place in between. And that's something that we as dentists, we're not trained on yet. This is going to be our new infection protocol.
Right.
And we're going to need to learn how to don and to doff our protective equipment properly so that we're not infecting ourselves and we're not infecting others. It's a whole other level of continuing education that is going to need to be required, just like our infection control education
doubt.
is required now. And when we look at what we've got now and what we're doing now, we talk about universal precautions. It's a common term in our dental world. We use universal precautions and then we're protected. Well, all of a sudden now we found out that our universal precautions are in fact not universal because it's not protecting us against COVID-19. So I think we really need to go back to the basics. Our principles that we learn and that we carry out and that we teach have changed now. And what we need to do is we need to be able to have a universal system of infection control. And that's where it becomes difficult and challenging as well, because in Canada, we're going province by province. Our dentistry is regulated provincially. We have a national body, just like you do in the States, but we listen to and we're regulated by our province. So our province is telling us this is the PPE that you're using, but perhaps in Ontario it's a different recommendation. And I'm
Wow.
saying perhaps because we all have our different
Right.
regulatory bodies, and so we really need to get together nationally and determine what it is that's advisable for our practices moving forward. And it's difficult because I think at this point we really don't know. It's still fluid, it's still changing.
As it is in the U.S., by the way. So let me just ask you a couple, just questions right off. So you have an emergency, a kid needs a pulpotomy. What do you do in these situations? I just got to ask because,
Yeah.
I've got to go to the office tomorrow. I've got 2 cracked teeth. I've got a patient with acute pain. How do you handle a pulpotomy in your practice? I'm just curious in an emergency mode right now.
Yeah, so at this point, our emergency mode in our province is to not create any aerosols. Having said
Right.
that, if we have somebody that's got a true emergency, we go through all of the protocols of, have you been infected? Have you been near somebody? Can you self-isolate for 14 days? All of that. We still want to minimize the aerosol spray as much as possible. But one of the things that we should look at, because moving forward, we will get in there and we will be able to start doing pulpotomies. So we need to start looking more at not what we've been doing traditionally with pulpotomies, but maybe some of the newer literature out there that's using newer materials that would allow us to do something like a partial pulpotomy so that we don't have to go in and be as invasive as we have been traditionally with our dentistry. So a partial pulpotomy, take out part of the pulp and then use a great bioactive material like biodentine or neo-MTA or our Theracal PT. So take advantage of these materials that have the ability to work when we're doing treatments like partial pulpotomies, being less invasive, allowing for a more predictable seal of our pulpotomy chamber, and also to have that bioactivity of the material to the tooth structure. So all of these things with our technology and our materials that have changed over time that general dentist population is slow to embrace. As KOLs and as member of Catapult, we get to trial these materials. We are we're encouraged to read the literature and try new materials so that we can be those leaders in the community. And by virtue of
Carla,
that,
let me just
sure.
let me interrupt though. So let me just ask you this: on the way you were doing a partial pulpotomy, I think it's important for our viewers. So in that case, you are going to minimize aerosol because you're drilling far less, or potentially
Right.
creating almost a lack of aerosol. I just want to be like point on
Yeah.
that. Is that right?
Yeah, absolutely. But you know what? On that point too, you got to know that your success rate of that type of a procedure is going to be based a lot upon correct diagnosis, that it actually is an irreversible, or pardon me, it actually is a reversible pulpitis rather than an irreversible pulpitis. Because irreversible pulpitis, if we've got a tooth that's doomed to extraction, that's got an infected radicular pulp, that's not going to help.
Got it. And so let me ask you a question on just even just screening your patients. How do you envision screening your patients and their families? Tell me, as a general dentist special, really just seeing kids, how are you going to be screening these children and the families? I'm just curious.
So I would think that once we get back to practices, the screening will probably be similar to how the screening was when we were just coming into this pandemic, where we were asking patients, about travel history, about their location to, or their proximity to an infected person, to any flu-like symptoms, that whole list of questions that we would ask a patient. I think that's probably going to be how things are handled initially when we go back, but then also to be treating every patient with those new universal precautions, whatever they may be deemed to be, so that we are minimizing any type of infectivity after that. And I want to say that with kids too, in general, kids have shown less of the disease than adults do. And what is not completely determined is, are they asymptomatic carriers of the COVID-19, of the novel coronavirus? Are they asymptomatic carriers, and are they bringing that disease to their families but not showing any symptoms? And I think that's something that's going to need to be addressed. Are we going to be able to test patients? Are we going to be doing some type of a chairside test for a patient before we're seeing them to determine whether they actually do have COVID? Or are we going to be able to test them and see if they have antibodies to COVID? And also what needs to be determined too, that still hasn't been determined, is, are we able to become reinfected with coronavirus?
So Carla, I'm going to
interrupt.
I'm going to interrupt because we've kind of covered a lot of those questions. And so I just want to stay a little bit more focused because I've got such limited time with you.
Sure.
Because we've already talked about testing and things like that. So let me ask you this. In your webinars that are both on Catapult and soon to be on Midway, do you talk about minimally invasive techniques? So what I'd like to do is just close on the techniques that you talk about in the webinars, so people can go and know what they're going to be looking at, if you don't mind.
Right. So minimally invasive techniques for pediatric patients has been a long-standing thing, because we have to deal with patients that are uncooperative all the time. And so we're going to now look at these minimally invasive techniques so that we don't create aerosol. So that would be including using silver diamine fluoride to arrest caries. So there's a product called Rivastar that's a combination of silver diamine fluoride and a second step of potassium iodide. That's by SDI, Southern Dental Industries. And that's an excellent product for arresting caries. So we need to go in there and we need to be able to arrest caries. We need to be able to treat, and this is for asymptomatic teeth. This is not for a tooth that's got a pulp exposure. So to use the Rivastar in that way, and then to follow it up and to restore that tooth using our glass ionomers. Great bioactive materials that just haven't had the love in North America that they deserve, or the love that they've had in Asia and Europe. So we need to be using these more often. That bioactivity allows us to be less invasive, do selective caries removal. So I talk about that in these webinars that you're referencing on Catapult and on Midway, and we talk about doing the caries arrest, and then we talk about what's called a SMART technique, a silver modified atraumatic restorative technique. And then the other thing that we can do with our silver and a minimally invasive technique is to do the Hall technique, where we're not removing any tooth structure at all, but we're simply placing a stainless steel crown over top of the carious tooth. And that's shown to have great success rates. And it's something that we're going to be doing more and more often in the future, in my opinion.
Love it. So I think for our audience and who obviously do treat children in their practices, I think you've got to go see Carla Cohn, both at Catapult Education or Midway Dental. Both sites will be offering. Carla, I really want to thank you for your time bringing Canada and children's dentistry to the new norm. And stay safe up there. Regards to Arnie. And thanks for being on the show.
Thanks, Lou. Same to you. And give a kiss to Aaron for me.
You will. Thank you. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.